at the City of Los Angeles. And one of the things we've been doing, I can't share my slides. Thank you. One of the things we've been doing, obviously, as every other city around the country, is working at finding better ways to both make access to COVID testing as well as COVID vaccination and COVID information. So I'm just going to walk through a little bit of what we've been doing in Los Angeles that I think is pretty replicable and that relates back to some of the open data work that we've been talking about at our calls. So in LA, like in many other cities, there's lots of things we've been doing around using technology and data pre-pandemic. So we're doing things with the Internet of Things and sensors around the city that look at everything from air quality to noise pollution. We do a lot, as Jeffrey was talking about, with geospatial and open data, with both Esri and OpenStreetMaps. We're doing things with virtual and augmented reality for helping kids explore the parks and areas of Los Angeles. And we're working with artificial intelligence and machine learning to do predictive analytics around fire safety and air quality. So these are just some of the things we normally were doing before the pandemic. Once the pandemic hit, we started looking at which of these technologies and what kind of data we had that would be useful in helping to understand at first, just kind of the issues around the pandemic and the spread, then how to help people be safer, what were some of the behaviors that would be most helpful, then making sure that people had access to test to find out if they had COVID, and then also access to the vaccine. So all of that is not as easy as it sounds, nor is it easy to make sure that it's equitable. There are people who tend to avoid the vaccine. There are people who really wanted the vaccine, which caused its own sort of bias in who came first for vaccination and how we made sure that we had equity around it. So some of the things that we've been using that we had before that have been really useful is first and foremost our open data portal. So this is the portal that has thousands of data sets and maps related to the regular data that we provide, whether that's information about the Port of Los Angeles, the airport, our Department of Water and Power, the zoo, Department of Transportation, our streets. And we almost always pair those data sets with stories. So when you look at our data portal, you'll see a place to search for data. You can also subscribe to open APIs on each of the data sets themselves. But there are also stories that help to put the data in context or combine the data sets in interesting ways. So some of the ones featured here are around food security, around community-based and community-level information, COVID, and issues around improving digital equity, which is sort of our digital divide in Los Angeles. And so this helps to put together the idea of the data that we have, the maps that we have, and how together those can tell us a story that could change the policy or the programs that we have. We also have other programs. The cute little robot here is our virtual assistant, City Hall information personality, Chip. And Chip is our digital assistant that lets you query on any page and enter an automated chat that helps you find information. We integrated early on our city ID, city digital assistant here with the CDC, the Center for Disease Control's database for answers to COVID questions. So if you came to any city website and you asked, why do I need to take a test, or is the vaccine safe? Then you would actually get the authoritative CDC answers and government answers, not just the ones that we had for the city of Los Angeles, but the ones for the country overall. We also have a call center that supports about 140 languages. 220 languages are spoken in the city of LA. And that call center is really helpful for people who just really needed someone to talk to. Either they needed help or support or services, or they were concerned, but they didn't, really just want to read an answer. They wanted to talk through it with somebody about whether they should come in for testing for COVID or whether they should get the vaccine. And then we used lots and lots of data and analytics. And we also did this with a new digital code of ethics that helped us to layer on top of everything the idea of making sure that the data we were using and sharing was secure and private, and that we always anonymized the data for those communities. So the kinds of products we ended up coming up with was a dashboard that really easily people could see what was sort of going well and what wasn't. So here you can see there are numbers. This is just a screen capture from an earlier day, where the numbers in green mean that our case rates are going in the right direction, going down. In other cases, if it's red, it means there's a concern in that area, that city services were up and running, that we're doing new social programs. And behind this data, you can click through on that dashboard and also find the breakdown by ethnicity and by neighborhood and by poverty level. And this was really important because, as became really clear throughout the pandemic, not everybody was treated the same way. People who had frontline work in grocery stores or restaurants, who are often people who were poor, they were suffering COVID at higher rates because they had more points of access to others, more chances of contracting the illness. People who took public transportation and were out and about often had more cases of illness than people who were in private cars. So by layering this information together, well, one, by being transparent about it, it helped us to understand what we needed to do and how we need to target certain communities to help them get better access to the vaccine or to testing. And then secondarily, going back again to Jeffrey's note and his amazing leadership and work in mapping throughout the world, as we started to look at the neighborhoods of Los Angeles, we looked at things like not only how many people in that neighborhood had been tested, but what was the likelihood that people in that neighborhood should be tested. So going back to predictive analytics to say not just what is happening, but what should be happening, because what the outcome was, people who were busier, people who were fearful of the outcomes of the test, people who didn't have time were less likely to come in for the test. And then we also looked at medical vulnerability. So these are the things that if you get COVID and you're also obese, or if you have COVID and you also have asthma, you have a higher likelihood of having a more serious version of COVID and of potentially dying. So we layered all that information together, and this helped us get better services more equitably out to people. What we ended up doing was standing up the country's largest vaccine testing site and then vaccine site at Dodger Stadium. That's our baseball stadium. And we would get through about 15 to 18,000 people a day. So this was a drive-through opportunity. But we realized, obviously, that's good for numbers, like getting a lot of people through, but it doesn't work if you don't have a car. It doesn't, and although it went through people could go through pretty fast, so it wasn't a big time sink. It was also one location in a city of 4 million people. So we started getting vaccine clinics with our fire department out to the communities that were hardest hit, but we're also lagging in the number of tests or the number of vaccines. And so we put all that data together, sent them out, set up some permanent smaller clinics, but then also just sent mobile clinics. So we would arrange to make sure that people had that information. We did a lot of texting. Originally, we did, and we still do, a lot of social media, but radio and television broadcast. But we found that if we really wanted to target some of the communities that had not responded initially, what we did is we did texting messages Sundays after church. And the faith-based organizations and our community-based organizations found that on Sunday afternoons, people tended to have more time and attention to pay to those kinds of messages and would react better at getting those messages. So we did a lot of push notifications, not just from the city, but from our community-based organizations. We also wanted to take some of those technologies I talked about at the beginning and figure out ways in which we could predict what would be the communities that needed a whole set of services. So we ran a COVID computational challenge. We had about 410 people from all over the world compete in this. It was a 2-week, it's considered like a 2-week hackathon. We had trainings, we had epidemiologists come and talk to the teams. We brought in all kinds of data about transportation and mobility, how many people were driving to different locations and spending money in different locations to figure out where there was high transmission rates, not just traditionally, but actually during this pandemic. And that the winning team was actually from the University of Southern California. And that team helped us to understand the neighborhoods that were going to be most hard hit based on the previous medical situations of the residents, the number of people working in essential businesses, access to transit, and then also access to healthy food and healthcare. So we wanted to make sure that we targeted those communities. So this was really helpful as well. And then we did a lot of work with our Data Science Federation. And this is a program that is partially funded by the National Science Foundation with specific scholars from underserved communities and with volunteer students from 18 universities across Southern California. And this group looks at how we're able to put together sort of new ideas and new technologies in ways that are more innovative. And just to note that during this time, it wasn't just about the pandemic and it wasn't just about getting access to the tests and the vaccine, but it was the consequences of people being out of work and the economic impact. And so in the middle of all of this, here in one of the wealthiest cities in the country, we ended up having a food security hackathon on the best ways to be getting food aid. It was some of our largest numbers of food distribution ever in the history of the city during this time, just to help people be able to get access to the very basic necessities. And we just stood up huge numbers of programs in food, in providing people with protective equipment, in providing people with access to free internet services as they needed to get through this pandemic. And then as we look forward, we're also leveraging some work we're doing with NASA called Predicting What We Breathe, which uses machine learning to combine satellite data and the data from our ground sensors to be able to understand air quality. And this is particularly poignant now because of the rates of increased asthma and increased respiratory problems from folks who have COVID. So our COVID long haulers, as we call them, are people who have had COVID and are still recovering, suffer greater from air quality, air pollution than others. So these are just some of the programs we really worked on, trying to make sure that we give people better access to city services, banking. We're starting large youth employment. We're starting the country's largest basic income guaranteed program. And we just did a huge amount around increasing connectivity across Los Angeles, and particularly free connectivity for people in public housing, the elderly and the youth. And then this is all part of our work that is connected to the UN Sustainable Development Goals, which I know we've all talked about frequently, but we still use that as part of our guiding principle. So thanks very much, Kat. I appreciate it. I don't know if there's any questions.
Can you talk a little bit? So thank you, Jean. That's really, really helpful. And I welcome anybody who wants to come off mute, ask a question, or ask in the chat. Can you talk a little bit about how you worked with the community engagement on getting the messages out in local languages and how that sort of trust building developed?
Sure. Yeah, so in Los Angeles, it's English, Spanish, and Korean are the 3 most popular languages. But we speak 220 languages. And this kind of information, more than just like, how to get free access to internet, this information is really important that you speak it in the person's native language, because there's sensitivities and there's concerns, and there was a lot of, and continues to still be some uncertainty about certain aspects of it. And so we ended up working through community-based organizations, many of which work with specific language-speaking populations, so like Korean or Russian or Armenian, and then, of course, Spanish. And then those groups were more trusted intermediaries. We did community-based training in those languages with those groups and with people from those populations. And then our 301 call center has 140 languages that are supported there verbally. So then someone can call up and speak in Swahili if they need to, or French or whatever language is of comfort to them, and be able to get the answers. And then finally on social media, we posted again everything in English and Spanish, but then a lot in other languages as well.
Joffrey, go ahead.
Yeah, thank you, Jean, for the wonderful presentation. It's really incredible to see the amount of like open data that is publicly accessible on the portal. My question was is around like the COVID vaccination. Do you have any data around that, like knowing how many people have been vaccinated in Los Angeles so far, and like where they can like get vaccinated, and I'm asking that because like that's like information that's very hard to get, like for where I am in Kampala or Uganda. We know like the government has been rolling out like vaccination, but it's very hard to get information on where to get the vaccination, or even who is eligible for the vaccination, because here only a few like the number of people who can be vaccinated is limited. So government had like to prioritize like on key essential workers who can get vaccinated, but that information is not really easy to get. So yeah, just wondering like what's your experience in Los Angeles? Is this information easily available?
So it was tricky. I think the biggest complaint, the biggest and most persistent complaint, at least for the program in Los Angeles, and I think for many places, at least in the States, it was confusion about who was eligible and confusion about whether the vaccine was safe at any given moment. I think that was, there was, it got politicized here, but more importantly than that, it was just not always clear. So there's a federal health department, and then there are local health departments, and there's a couple in between. And they might have had different interpretations. We always tried to follow our local health department in the larger county of Los Angeles, but they would sometimes, change because things were being learned as we went. And so I think that has been difficult. And I don't know any way around the fact that, we don't know all the things about this disease, and we don't know all the things about eligibility. So we took a stance of saying frequent communications in times of uncertainty help. And so the mayor had press conferences every night that we put out for all the news services. And then we put out frequent information. So for the first, 9 months, it was nightly press conferences and just lots of communication, even if sometimes that, things were changing. I think the other thing too about the vaccine clinics is that, putting a large clinic in one spot, like a sports stadium, was really helpful, because like everybody knew, whether they were big fans or not, like everybody knew where it was. It was central, because that's what sports stadiums do. They figure out a central location that's easy to get to. And so that was actually very helpful. But what was really helpful after the initial surge of that was being able to take clinics, like basically we took our paramedics, our fire department, and took those out to the local communities. And we got that word out by doing these Sunday texting messages through our local faith-based organizations. So it did take a fair amount of coordination between and trust building between some of the local community groups and the government to be able to make sure that the government, if the government said they're going to be at a location on Tuesday, that they showed up at that location on Tuesday.
And I just had one more question, Jean, which is, you're deputy mayor, you're working in the government on these issues. How does this work sustain for future administrations? So how can governments build in these kinds of systems and resilience going forward?
So, separating, there had to be coordination between the regular part of the government, which is like the departments, and then the political arm of the elected officials. So although a lot of the strategy came from the mayor, Mayor Eric Garcetti, and our city council, that the implementation was at the hands of our fire department and many others who helped and stepped up for that. So it became part and parcel of the way in which we did work and the way in which we were able to sort of administer it. The other part was that we worked on supply chains. So this is something we're doing a X Prize Alliance meeting this week on how all of us can try to help with the surge in India. And so one of the challenges and for everybody is supply chain, and especially early on, remember, we couldn't get masks and gloves and gowns. So we worked with suppliers throughout the world to work on bringing that in through the Port of Los Angeles and then doing distribution out to all the hospitals and clinics so that they didn't have to think about that we kind of built that supply chain. So, and that's through a city department, which is the port. And so I think trying to build that in is helpful. And then just, we built a lot of connections with the Department of Public Health, which, we worked with before, but never to this extent before. And so I think they were able to build those bridges amongst many different cities in the region to be able to do this implementation. And then we just put everything in our open data portal and built out a lot of dashboards and lessons so that the next administration would be able to follow.
Awesome. Okay. Thank you. I'd like to share from Yema Thompson, who gave this talk. She's unfortunately not able to join live because of connectivity issues, but she's been working on data for equitable vaccines and the pandemic response in Sierra Leone.
So I'm going to go on video for just a few seconds, and then just to ensure I stay online, I have to go off again. So this is me. Can you see me?
Yeah, we can see you.
Because my bandwidth is very low, I may need to go off again. But hi, everyone. Thanks, Katz, and hi, everyone. Thanks for joining us today. Unfortunately, I cannot see online, so you can see me, but I'm sure you can see a picture of me on the screen. I've asked Katz to share a screen. I don't know whether that screen is being shown online now. Can we all see the screen? Yes, good.
Yes, it's online, it's shared.
Perfect. Yeah. So what you can see is the current situation of our COVID-19 vaccination in Sierra Leone. And so, but I want to go through some statistics. I always like to use the data, as Kat would say, to tell you how much vaccine we have in country and how much is currently being rolled out. Sierra Leone cannot buy its own vaccine, so all the vaccines that we have been donated. We have 200,000 doses of Sinopharm, which was donated by China. 96,000 doses of AstraZeneca was donated from the COVAX facility. And 42,000 doses of AstraZeneca was also donated through the African Union Commission. So out of all that donation, we've had a cumulative total of 62,132 people have received their first dose. That's really, really low. And we have had a series of challenges in the vaccine rollouts. And as you can see also on the data on the screen, out of those 62,132, only 7,427 have gone for the second dose. So there's a mix of issues here why the uptake has been low, especially for women. Even though the government has also expanded the vaccine outreach to include all persons over the age of 40 years, we still see low numbers of people turning up at the vaccine sites. And so my work at NACOVAC includes working with all media. traditional and social media. And I'm sure many of you who are listening are aware that we are currently caught in the age of information disinformation, where fake news is being peddled around about the vaccines. And when Jean was talking about the religious beliefs, and more recently during the Ramadan, and there was this news being peddled that Muslims cannot take the vaccines whilst fasting. 2 weeks ago, I hosted the Council of Imams with support from UNICEF, and they were able to dispel that rumor. But more importantly, we need the media to be engaged to ensure that the right information, people receive the right information. Journalists have covered outbreaks of infectious diseases since 1721. We always say from the Boston smallpox epidemic, so the outbreaks of Ebola in West Africa and the Democratic Republic of the Congo, journalists have been on the front lines. And the mass media has enormous potential to influence health-related behaviors and perceptions, especially more so during COVID-19. So at NACOVAC, what we have been doing, we have been posting what we call FAQs, daily frequently asked questions. And the FAQ speaks to the trending rumors that are going around around Sierra Leone. The rumors actually range from districts to districts. So if you move from the northern side of Sierra Leone, the rumors roaming in the north may be different from what is happening in the urban setting in Freetown or even in rural settings. And I always jokingly say in meetings that I remember going to my village some weeks ago, and I went to one of the villages, and people thought I was going to, because I was fully maxed up, and they said, "Oh, the people who are going to give the vaccines are here." And these are hard to reach areas where people have their own belief of what the vaccine is about. People even say that if you're vaccinated, it may affect your manhood. People say if you're vaccinated, you may die. So there are different, rumors being peddled around the vaccine. And that is why when you look, and that is why I want to keep this data on. When you look at the data, you will see that the vaccine rollouts has been different, uptake has been different from district to district. In urban settings, like the western urban area, where Freetown is situated, you have more people taking the vaccine. So you have about 9,611 people who have been vaccinated in the Freetown area. However, when you go to hard-to-reach areas in the north, especially, you find out Falaba, for example, there is little uptake there. About 1,820 people have taken the vaccine. And so what we have done is try to see how we can improve on media information literacy. Because we understand that technology has a great deal to play to even support the traditional media. Because of the media economy that we have in Sierra Leone, our traditional media depend on social media for their news. So if the news being peddled on social media is wrong, then we have a challenge, because it means that the traditional media will just peddle exactly what social media is saying. So to curb this challenge and to address this challenge, we have been working with stakeholders to see how we can improve on media information literacy skills for all Sierra Leoneans, including journalists. Because we believe that media and information literacy is linked to access to information, free expression, and education. And it will enable all Sierra Leoneans to have the ability to access, analyze, and create their own media, and also be able to freely express themselves with credible information, especially as we are now engaging in a digital society. This has not been easy. It's been quite challenging because of the political dynamics as well. But we are slowly getting there. And we are engaging with traditional healers. We are engaging the media. we're engaging the religious leaders. We are also engaging, we will be working with schools. We are setting up media information literacy school clubs. We are starting off with 2 school clubs. It's a small number, but we think that we should also address the younger ones, so that if maybe the older ones are succumbing to fake news, the younger ones may be able to, say to their mothers, no, wait a minute, because sometimes my 8-year-old son always have a honest conversation with me and I listen to him. So we also think that maybe we should also help the younger ones to be media literate, so that it can empower them to understand, inquire, create, communicate, and think critically about the issues around them, more so around COVID-19. Kat, am I still within my 7 minutes? I can talk and talk and talk. So overall, we all need to be a media information literate society. It's not only the journalists, because even when you're reading the newspapers or watching, for example, in the US, Fox News or CNN, if you're media literate, you'll be able to discern, to find out whether what the media is saying is fact-based, is a credible information, or maybe there's something around it that you need to actually see whether you can critically investigate as well. Thank you.
Okay, thanks all. And then just, and welcome Marianne, if you want to introduce yourself. And just in the last few minutes, I wanted to also share some insights from Philip Tigo, who joined us and who has been working with the Africa Union on the 4th Industrial Revolution, and is trying to design and work with a lot of different donors on a better way of approaching data vaccine distribution and just data-driven development in general. So if you'll allow me, share one more.
I think for me, and this is, first of all, a great panel, all women. So I'm just trying to add my little voice here as affirmative action on the panel. Of course, we had a Kenyan speaker in that, and this was my vantage point from March 11 when the first case was announced in Kenya by the president. A couple of things and what we began to see as major trends, right? A major trend around COVID-19, of course, was the speed of the spread. This is why I think you had either lockdowns or sort of federated lockdowns. The second piece was then the other mega trend was somehow you have to look at vulnerable populations. Then the other mega trend, of course, is then looking at, okay, so if you cannot curb the spread, if you cannot protect vulnerable populations, then how good is your health system or health facility capacity? And that's why my sense then becomes important, why artificial intelligence and all these new modes of technologies are important, simply to begin to triangulate those three. In countries and evolved economies like the US, this was done very well because you had health facility data, including their capacity. You had good census data in terms of vulnerable populations, and you had good mobility data based on spread. Unfortunately, in countries like ours, where we are data poor, we didn't have any of those. And my sense is that we know that when you extrapolate that into the future, if you could not manage COVID-19 within those three megatrends, then it becomes very difficult to then think that you can also manage vaccine distribution. Beyond even the human issues around misinformation, do you have a system that can deliver? Then can you counter misinformation? And I think for me, that's the challenge that we begin to see. And when you look backwards, it's what Leone has mentioned, years and years of disinvestment within the health system, years and years of marginalization of communities. Then, because then you lose trust to the extent that if something is free, what makes us think that finally, because you've decided to see this community as visible, that they will take what you give them after years of marginalization, simply because it's a health issue? And for me, the contradiction is, how come the same population, and let's talk about Africa, we're the most highly vaccinated communities. If you extrapolate the data on other vaccinations and immunizations, how come people are still taking them? at the same time of COVID, while people are not taking COVID vaccines. So I think for me, these are the mega trends in terms of thinking through them. Digitalization doesn't, or technology or use of innovation does not happen in a vacuum. And that people now know that they matter and they need to be involved in decisions that affect their lives. So you bringing a vaccine does not necessarily mean that all of a sudden people will take it. I think for me, that's the first thing I'm seeing. The second mega trend is how do we improve our data systems? Forget even extrapolation into the technologies that need to mine them, do clever things around predictive analytics or the apps or the issue around that. How do we build our data systems? Which means we need to get the foundations right. And increasing in the last year, whispering into the ears of policymakers around, can we get the foundations right? First foundation is data and data. Second is infrastructure. Would want to deploy artificial intelligence, but if we don't have infrastructure, whether it's digital infrastructure or physical infrastructure, like facilitates, getting our censuses right. The third piece is skills, and I think Leone has mentioned this, because we are in an age of an acceleration. How do you ensure that the skills and capabilities are within indigenous communities? Because unfortunately, our first and second wave, there's a lot of international solidarity, but then there's fatigue, because then the world operates in a response mechanism, understanding that a crisis is finite, is within a particular time frame. That's not happening anymore. So then how do you ensure that we build resiliency of communities? And I think for me, the last mega trend is then, how do you balance, and there's issues that have been raised around ethics, and not ethics even around data, ethics even around vaccine distribution. Secondly is human solidarity. And I think the third thing is a sense of community. I think it's an all-in effort, and a couple of countries that are getting it right from the get-go did an all-in effort. And then the second, and then I think for me, and this is really my final point, is how do we get out of this crisis mode? Because there's always a crisis. Yema is in the call, and Ebola was a crisis. There were lessons learned. How come we didn't learn from it to build resilient systems, at least for Africa, right? So my sense again is that how do we flip the model? Let's start from resiliency. Build resilient systems, then you can respond faster, you can recover faster. And in that sense, it must be all-inclusive. And with that, thanks, Kat.
Okay, thanks, Abba. So in the last few minutes, and I thought that Philip's call to action was really helpful, which is how do we flip these systems on their head and how to build in resilient systems. So curious what anybody would offer on this. And of course, if you have work that you're currently involved in that you wanted to share out or get feedback on, these last few minutes of the call is also the time to do that. But I know that I'll be taking with me, the lessons from Yema, from Jean, and the provocations from Philip of what do resilient systems really look like? How are they built in long term? And how can the work that is being done serve those systems in a stronger and long-term way? So open the floor if anybody wants to jump in.
Kat, this is Jean. I'll just echo up some of the things that Yema and Philip both said, but particularly around the ability to get consistent communication out. And this kind of echoes what Jeffrey was talking about earlier. It's even in times of uncertainty, even if you don't know the exact information, getting out what you know and sharing that with people is both calming and informative and builds trust. And I think part of the challenge that governments have seen around getting people tested, getting the information out, as Yema was talking about, kind of the misinformation and misconceptions, it rides on government's hesitation to always be truthful in the past. And so if you don't have that trust and that truthful relationship, it's very hard then when you have something very clear that really needs to be done to get people to act upon it. And so I think it's, always realizing that it's not just about this crisis. And maybe this goes back to the idea of resiliency. It's not this crisis always, it's always the groundwork for the next crisis that we're laying to.
Yeah, I think that's absolutely true and fitting for this discussion and this group, that the point is open. And the more that we have open systems, the more that we can build trust. And you can claim that you have an open government, that you're sharing information out, but unless you're really showing the data, and giving concrete evidence of what kind of information you have. And as you said, Jean, even if you're not, even if some of the information you have is incomplete, if you acknowledge that, that's a way of building trust, so that that people are looking for more trusted actors, and really combating, you know, as Yema was speaking about, the amount of misinformation, you know, how to build, you know, who are the trusted people that we look to in our communities and our societies to provide real knowledge and real information. And so I was really struck by her, you know, gathering the imams together to counter some of the misinformation. But that's a lot of work to take the time to have those meetings, to get the updates out, and it can be turned around with, you know, a post with a something sent out on WhatsApp, and it's really hard to claw that back. So you know, making sure that from the top, our governments are transparent, and then also that we're putting in a lot of education for younger people on how to recognize misinformation and disinformation, and how to counter it. Mariam Samu, you joined us a bit late. Would you like to introduce yourself? I'm not sure if your audio works. Okay. All right, y'all. Thank you for taking the time to join. I know that Florence wasn't able to join, but she has been working on the Africa Digital Skills Conference again this year. And she's going to start it in July with workshops specifically on data science and machine learning. So if that's something that's interesting to you, if you would like to participate, if you would like to serve as a trainer, or if you want to suggest anyone as a trainer, I will drop in the website. Please follow up with them directly. And if anybody else has any other updates about their work, I know that Geoffrey, I believe you're still looking for locations for State of the Map Africa. So maybe if you share with us something that we can share out online publicly, we'd be happy to do so. And anybody else, please feel free. And also, if you find that these are helpful, if you have other speakers, topics that you'd like to hear from, we've sort of been alternating these between discussions like these and practical workshops. So we're welcome and open to any requests for topics or trainings that you are seeking or feel would be useful. So I will put my email in. You can always follow up with me. And thank you for your time.
Thanks, Kat. Appreciate you putting it together.
Thanks, Jean.
Thanks, Kat.
Bye.
Thanks, everyone.
Thanks, Laura. Thanks, Geoffrey. Thanks, Sharon, for joining. Bye-bye.
Yeah. Bye.